Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Federal government suspends Emirates flights from Nigeria for airlifting passengers using rapid antigen tests conducted by laboratories not approved by regulatory authorities. With the country recording more cases of the coronavirus, Kano state marshals patrol streets, communities sensitizing on COVID-19 non-pharmaceutical protocols. And in Ghana, 15 lawmakers test positive for COVID-19. Nigeria has conducted over 1.3 million tests, confirming 136,030 cases. Last night, the center reported 14 deaths, putting the death toll at 1,632. So far, 110,000 cases have been discharged, and they include 824 community recoveries in Lagos State, 444 in the FCT, and 142 in Plateau State. According to the Nigeria Center for Disease Control, of the new 1,340 cases, they are reported from 21 states and the Federal Capital Territory, which displaced Lagos for the first time, recording a higher daily tally of 320 cases, followed by Lagos, 275, and in third place you have Rivers, 117, and then you have Oyo State, which recorded 100 cases. Other states registered cases below 60 cases. The NCDC says members of the public should continue to take responsibility and adhere to the non-pharmaceutical protocols. The federal government has placed a 72-hour suspension on outbound Emirates flights from Nigeria. This is contained in a circular issued by the Nigerian Civil Aviation Authority, NCAA. It states that the suspension followed a violation of guidelines placed by the Presidential Task Force on COVID-19. According to the NCAA Director General, Mr. Musa Nuhu, the airline has been airlifting passengers from Nigeria using rapid antigen tests conducted by laboratories not approved by regulatory authorities. The PTF has directed that Emirates Airlines should either accept passengers without RDT, pending when the infrastructure and logistics are put in place, or suspend its flights to and from Nigeria until such a time when the required infrastructure and logistics are fully established and implemented. The statement reads in part that Emirates Airline has not been in compliance with the two options given by the PTF, as records obtained from the Nigerian Airspace Management Agency indicate that Emirates Airlines operated the flights from both the Murtala Mohammed International Airport, Lagos, and Nnamdi Azikiwe International Airport, Abuja. The NCAA says additional sanctions would be imposed on Emirates Airlines for the violations of the COVID-19 protocols. Now, the Minister of State for Health and the Director General of the Nigeria Center for Disease Control are in Taraba State to formally hand over the Infectious Diseases Care Center and the Molecular Laboratory at the Federal Medical Center, Jalingo. This is coming as the state government seeks more intervention in areas of more testing centers for COVID-19 and also hepatitis. Before the ceremony, the health experts paid a courtesy visit to the governor at the Government House, Jalingo. For the first time since the outbreak of the COVID-19 pandemic in Taraba State, the Minister of State for Health and the DG, the Nigeria Center for Disease Control, are in the state. Their mission is to find out the level of response to the pandemic in the state and also to hand over the Emergency Operation and Infectious Diseases Center at the Federal Medical Center.
I want to thank you because we know that been working with us at the center, because it's all of government, all of society approach, that is the management and the response activities to COVID-19 pandemic. And the federal government cannot do it alone. We need to work together in collaboration in cooperation with the states as well.
In all aspects of the response, what we have found is that this is a long response, but Your Excellency, I think it will also change the nature of public health for the future. So we're really encouraging a lot of the states. But moving forward, these guys, we need to really lift them up and give them, grow their work.
While the state governor appreciates the visit and the establishment of 2 COVID-19 testing centers in the state, he also sought the intervention of the NCDC and the federal government in tackling latter fever and hepatitis.
You people have made us proud. I was in Dubai recently, and on landing, you have to queue to show your certificate. But the moment I was coming, they said Nigeria. They said, yes, you go. Nigeria have good pass. Go. So all the Nigerians were cleared.
While the Taraba state government calls for strict adherence to the COVID-19 protocols, the state has a total of over 433 confirmed cases of the virus, with 39 of them presently undergoing treatment, and over 370 persons have been successfully treated and discharged, while it has lost 15 persons to the virus. Multiple variants of the virus that causes COVID-19 are circulating globally. The United Kingdom identified a variant called B.1.1.7 with a large number of mutations in the fall of 2020. Now, this variant spreads more easily and quickly than other variants, according to scientists. It has been detected in many countries around the world. The variant was first detected in the U.S. at the end of December 2020. In South Africa, there is another variant called the B.1.351, which emerged independently of the B.1.1.7, originally detected in early October 2020. And this particular one shares some mutations with the B.1.1.7 cases caused by this variant. And they have been reported in the U.S. and other countries as well. And Brazil, a variant called the P.1 emerged that was first identified in travelers from Brazil who were tested during routine screening at an airport in Japan in early January. Well, this variant contains a set of additional mutations that may affect its ability to be recognized by antibodies. Now, these variants seem to spread more easily and quickly, but what do we know about the severity of the type of variants that we have in Nigeria? Well, joining us now is Dr. Jafia Abubakar, the Deputy Incident Manager at COVID-19 Emergency Operations Center. He joins us now. Thank you for joining us on the program.
Yeah, thank you so much, Millicent. I'm happy to be here.
All right. Dr. Abubakar, how many variants of COVID-19 are in Nigeria? And really, how is it that the virus keeps mutating?
Yeah, so generally, viruses, they mutate all the time. That you have a new variant is really not new. What we're really concerned is that if there is a new variant, is it linked with a different outcome? Such as, do you have increased or decreased transmission? Do you have increased or decreased, severity or mortality? How about increase or decrease in responsiveness to vaccines and therapeutics? These are the things that we consider when we hear that there's mutation. Now, just like you've mentioned, there are a few variants are called variants of concern. This is because they are contributing to increased transmission. This has been seen in the B.1.1.7 that you've mentioned about that was noticed in UK sometimes in September. And of course, the B.1.351 that is also noticed in South Africa, and the P.1 that were noticed in Japan amongst travelers that, went to Japan from Brazil. Now, generally, all over the world, these variants of concern are in over 60 countries to date, including Nigeria. So, but in Nigeria, so far, what we have seen a total of 7 B.1.1.7 variants that were detected through in-country genomic sequencing. This sequencing was done between the NCDC and the African Center for Excellence in Genomics and Infectious Diseases. 5 of these B11 variants were from people in Osun, 1 in Kwara, and 1, of course, in FCT. Again, we have seen travelers from Nigeria that have been to countries like Canada. 3 of them were detected to have the B117 strain, and 2 in Japan were also detected to have, the B11 strain. So generally, in what we are doing at the NCDC, because so far from the onset of this outbreak till date, we're able to sequence about 300 viruses. Of these 300 viruses that we were able to sequence, we were able to identify 43 lineages of SARS-CoV viruses that are circulating in Nigeria. But of course, the one of concern now in Nigeria is the B117.
Tell us, with regards to the tests, are these new variants, especially the ones that are cause for concern, spreading faster and that are said to be deadlier, are they easily detectable using the PCR standard of testing or the RDTs?
So generally, for you to detect a new variant, you need to do what is called sequencing, which is a process that requires determining the complete DNA sequence of the organism's genome. And this is a very high throughput technology that unfortunately is only available in 3 laboratories in Nigeria. That is the NCDC National Reference Laboratory, the SGIT lab in Redeemers University that I've mentioned, and of course the Nigerian Institute of Medical Research. These are the only labs that have the capacity to do this DNA sequencing in Nigeria. However, the NCDC is working hard to ensure that we have, we move up to scale to ensure that this sequencing is done across the country. But again, variants, once they are in circulation, the normal PCR and the RDTs can detect them. But to know that this is a variant, this is this variant, this is that variant, you need to do the sequencing for you to really understand the kind of variant you're dealing with.
Finally and briefly, how do these variants affect existing therapies, treatments for COVID-19, for patients at isolation centers, those that are recovering at home, and also for the vaccines that are being rolled out around the world?
Yeah, so far, from the studies that were conducted recently, the Pfizer vaccine and the Moderna vaccines have been shown to be effective even against the B11 variant strain. However, a lot of further studies need to be conducted, to determine the effectiveness of vaccines on these new strains. But one thing that I want to mention quickly is that all of us know that prevention against all these variants can be achieved through a simple method, through adherence, to the public health measures that we've been talking about, the non-pharmaceutical interventions. We should ensure we maintain our the hand hygiene. We should keep our physical distancing. We should avoid crowds and gatherings and ensure the proper use of, face mask and limit or avoid, non-essential travels. If we adhere to these non-pharmaceutical interventions, it's one way of ensuring that we prevent, ourselves from getting this infection.
We appreciate your time on the program. Dr. Jafia Abubakar, Deputy Incident Manager, COVID-19 Emergency Operations Center. Thank you for joining us on the program.
Thank you for having me.
Now, with the community spread of the virus in many states, especially Kano, last month, the governor, Abdullahi Ganduje, set up 2,000 marshals to curtail the spread of COVID-19. Today, the marshals are out on the streets of Kano in their uniforms, speaking to everyone on the need to observe the COVID-19 safety protocols.
These marshals are meant to sensitize and educate members of the public on what COVID-19 is, how it is transmitted, and what they can do to prevent transmission of this virus among people.
Right from the announcement day, people are beginning to scared, and today, as you people come out massively, people are obeying the law.
It's a very good development because people need to understand that this thing is very important for them, and this COVID-19 is real. So they need to be taking measures, and it's very good.
New rules are being put in place in the United Arab Emirates by the government over a surge in COVID-19 cases. In the city of Dubai, our correspondent Maiwa Adegoke captures the concerns of a possible lockdown.
A new set of COVID-19 guidelines has been introduced by the Dubai government as part of steps to crack down on the spike in the number of new cases. In a recent circular, entertainment and sports venues, including cinemas, are directed to operate at 50% capacity. Restaurants, swimming pools, private beaches and hotels at 70%. Restaurants and cafes will now be required to close by 1 a.m., while brunches, pubs and bars are to shut down till the end of February. This has sparked concerns about another possible lockdown.
My first issue was, oh my God, now what? And the businesses which are not to do with the service sector are going to work out fine because it's anyway work from home or etc., etc., etc. But us, when we come in the service sector, us, hotels, bars and lounges, pubs, all of them are affected in a very bad way.
Punishments for establishments and individuals not enforcing social distancing and other rules have been severe. Meanwhile, there has been increased private sector support for government vaccination drive. Several restaurants, such as Little Italy, are offering discounts to those who have taken the COVID-19 jab. The idea doubles as a business strategy. At Bolgopa, a Bollywood-themed restaurant in the business district Karama, managing partner Richa has helped all staff to get vaccinated.
My team was always very supportive to me, and when I informed them that we are going for the vaccination, they all were very happy, and they being a resident also, they felt that it is their responsibility also to get the vaccinated.
Government continues to assure residents it is on top of the situation as it increases field inspections to ensure strict compliance. It is also asking residents to report any establishment caught flouting safety rules. From Dubai in the UAE, Mayowa Adegoke for Channels Television News.
And to the EU, where following the authorization and deployment of the first COVID-19 vaccines, all countries have started vaccination campaigns by vaccinating people in priority groups. However, there have been major bottlenecks. Deutsche Welle correspondent Chelsea Dulani joins us from Berlin for more. Hello, Chelsea. Thanks for joining us. Now, as the European Union continues to confront a shortage of vaccines, some are calling for the bloc to consider using Russia's Sputnik vaccine to help increase supply. EU-Russia relations are strained. So how likely is this move?
Well, pressure is certainly building on the EU to find other sources for vaccines. We've seen the EU vaccine rollout really get off to a slow start, and it's been called by some politicians here in Europe a scandal. Only about 2% of the European population has been vaccinated against the coronavirus so far, and that's far below the rates we've seen, for example, in the UK and the US. EU leaders for now are really putting the blame on manufacturers such as AstraZeneca and BioNTech Pfizer, who say that they're dealing with supply bottlenecks, and they have pledged to really try and ramp up production, but that likely will be slow. So the EU is under a lot of pressure to find other sources of vaccines. The Sputnik 5 vaccine that was developed by Russia is one option, and there had been a lot of skepticism of this vaccine last year because it had been developed very quickly, but some of that was laid to rest this week whenever a prestigious medical journal found that the vaccine was over 91% effective in clinical trials. So we have seen several political leaders, including Chancellor Angela Merkel here in Germany, say that maybe that's something that we should consider to really ramp up our available supply of vaccines. But of course, it will be a diplomatic and a political challenge for Europe. European relations with Russia are very, very low right now after the imprisonment of Putin critic Alexei Navalny. But given the vaccine challenges we're seeing, perhaps the need for more vaccines will rule out over the political challenges.
Many wealthy countries like Germany have pledged to help provide vaccines to poorer countries through efforts like WHO's COVAX program. Will the production delays we're seeing in the world's richest countries impact, how fast vaccines reach the rest of the world?
Well, the production challenges we're seeing here in Europe and in other developed countries definitely don't bode well for the rest of the world. There had already been a lot of concern heading into the rollout of vaccines that richer countries were going to really win out because they can pay more, they could negotiate better with these vaccine manufacturers. And there had been a lot of efforts to help mitigate that, including through the COVAX facility, which has promised about 2 billion doses to the world by the end of the year, but they haven't even started to send out those doses yet, and it likely will take even longer for COVAX to begin the vaccination campaigns. We've seen some public health experts warn that the developing world is going to be about 6 to 8 months behind developed countries in terms of vaccination efforts. And if you think about how long it's going to take countries like Germany and the U.S. to reach this so-called herd immunity level, most don't expect that until later on in this year. So it means that developing countries are going to be battling the coronavirus for much longer. And public health experts and economists both agree that that's quite a big problem because the virus could continue to mutate. And as well, that means we likely will continue to see restrictions that impact the global economy.
And Chelsea, the pandemic has hit German beer sales too. Sales fell more than 5% last year in the beer-obsessed country. Tell us more.
Well, last year dealt a major blow to the German beer industry. Sales were down 5.5%. That's actually the biggest decline in post-war history for the industry. And the bulk of that was due to the lockdown measures that were in place for a lot of last year. They closed bars, restaurants, beer gardens. We also saw major beer drinking events like Oktoberfest canceled. So that's millions and millions of dollars worth of income for a lot of breweries, a lot of restaurants, a lot of event companies. Some of these companies reported that sales were down about 70% for them last year. So certainly a major blow. And of course, the outlook for reopening is still quite tenuous here. It's not clear if we'll be able to, have an Oktoberfest again this year. So in the wake of this data, we have seen more and more industry participants, more and more breweries, more and more companies saying the government needs to step in and help, preserve this really important part of German culture.
Many thanks, Chelsea Delany, Deutsche Welle correspondent. Thank you for that update. Now, Ghana's parliament will restrict its sessions to twice a week after 15 lawmakers and dozens of legislative staff tested positive for COVID-19. Ghana's President, Nana Akufo-Addo, on Sunday reimposed a ban on social gatherings as the number of COVID-19 cases spiked in the West African nation. According to the Parliament Speaker, Alban Bagbin, out of those who submitted themselves for the test in Parliament, 15 MPs tested positive to the virus, or 15 have been contacted and advised to self-isolate. He said 56 staffers had also tested positive, forcing him to decide the Parliament would only sit on Tuesdays and Thursdays in a measure to control the spread. And take a look at our website, channelstv.com. It has the latest updates on the pandemic. All you need to do is log on. You can access news and health. There's also politics, business, sports, all coming from Africa and the rest of the world. That's the program this evening. Thank you for watching. I'm Millicent Wonka. Stay safe.